Welcome back guys. Now in this video, let's discuss about intracellular accumulations. Okay, so within the cell, there are accumulation of certain substances. So what are they? For example, let's begin with the pigments. Okay, pigments. The first pigment that I want to discuss here is melanin. Okay, so melanin. You know, melanin is a pigment which is derived from tyrosine. Okay, so it's a pigment derived from tyrosine. Okay, now see, wherever there is melanin, it gives black color pigmentation. Black color. Okay, it's going to give the black color to the skin. Our skin is having some pigment, right? That pigment is nothing but the melanin. See, you can see this melanin pigmentation. Okay, it's there in the innermost layer of the epidermis. Okay, so here in the stratum basal layer, there are melanocytes present, and those melanocytes are the ones which are producing this melanin, and that melanin is the one which gives the color to the skin. Okay, pigmentation. So what is the stain for this melanin? So if you want to look these cells at the melanin under the microscope, you have to put some stain. So what is the stain? The stain is called as Mason Fontana. So Mason Fontana is a stain, one stain you can use. You can also use small stain, and the stains which are used in immunohistochemistry, the immunohistochemical stains. So immunohistochemical stain is HMB45. So HMB45 is the immunohistochemical stain for melanin, and the EHC studies. Okay, enzyme histochemistry studies, you can use dopa oxidase. So these are the stains which are used for the melanin. Now let me discuss some more important points about the melanin. See, what is this? What is this part of the brain? See, it's a midbrain actually. It's a part of brainstem. Okay, midbrain, pons medulla, you know, right? This is a midbrain, mesencephalon. Now this is a healthy brain. This is a normal healthy midbrain, where you can see this pigmentation, this pigmented area which I am showing you here. This pigmented area is called as a substantia nigra, which contains substantia nigra pars compacta, pars reticularis. See, this is the area where dopaminergic neurons are present. In that area, there are dopaminergic neurons present. Okay, dopamine is also coming from the same tyrosine. Okay, see, actually here there is a melanin, dopamine and melanin present here. So there is pigmentation, okay, in the substantia nigra. But there is a disease called as Parkinsonism. Okay, there is a disease called as Parkinsonism. So what is happening in the Parkinsonism? There is a depigmentation. Means the dopaminergic neurons which are present in this area, they are dead. So the dopaminergic neurons which are present in the nigrostriatal pathway, or the dopaminergic neurons which are present in the substantia nigra of the midbrain, they are gone. So there is depigmentation, which can lead to a condition called as Parkinsonism, where the patient is going to have bradykinesia, tremors. Okay, those things. Okay, so what I am trying to put here is intracellular accumulation, which pigment can be there within our cells, the melanin which will give the color to our skin. Next, the second pigment is hemosiderin. Hemosiderin. Hemosiderin, it is a iron pigment or iron accumulation. So iron accumulation. So in which condition you can see such hemosiderin pigmentation within our cells? The iron accumulation within the cells. A pathological condition called as hemochromatosis. Okay, hemochromatosis. So in hemochromatosis, the patient is going to have iron overloaded state. This is iron overload. See, the one point which I want you to know is, we can take the iron, we can absorb the iron, but there is no mechanism to excrete the iron. There is no special mechanism to excrete the iron. So we should be very much cautious when to absorb the iron, how much to absorb the iron. So we are very much cautious. Okay, there is a regulatory uptake of the iron. But in those patients who are having hemochromatosis, they will be having high amounts of iron accumulation in the body. Okay, there is so much amount of iron accumulation in the body, which is usually seen with conditions like thalassemia. Okay, beta thal major. So in conditions like beta thalassemia major, they are going to have, they are continuous, their whole life depends on the blood transfusions. They are going to take blood transfusions every single week. They are taking these blood transfusions. They are like blood vampires. They are drinking the blood, okay, otherwise they won't survive. If they are taking the blood, it simply means that they are taking the iron from outside. The blood is containing hemoglobin, hemoglobin contains iron. If you are taking the transfusions, you are just taking the iron. So that iron will come and accumulate within your organs. Especially here, you can clearly see the iron is getting accumulated within the tubules of the nephron. Iron accumulation within the tubules of the nephron. Okay, so this iron accumulation is the iron is going to give this hemosiderin, okay, this pigmentation. The point which I want you to know is, what is the stain used for this iron? To look for the iron, what is the stain that is used? It's a pearl stain. It's a pearl stain. Okay, it's a pearl stain or Prussian blue. So it's a pearl stain or Prussian blue which is used for looking at the iron. The second accumulation which I want to discuss is copper accumulation. So copper is getting accumulated. In which disease copper is getting accumulated? There is a disease called as copper overloaded state, which is called as the Wilson's disease. Okay, Wilson's disease. Now in this Wilson's disease, what is the problem? The problem is with the gene that is ATP7B. Okay, ATP7B gene mutation, copper accumulation. This Wilson's disease is also called as hepatolenticular degeneration. Hepatolenticular degeneration. So in the word itself, in the name itself, it's there hepato, which means the liver. Lenticular means the lens, not the lens in your eyes. It's the lentiform nucleus in the brain. Lentiform nucleus, which is made up of the chordate and putamen. Okay, so in that area, the copper is getting deposited. A copper is Cu2 plus, like it can damage. We can see free radical. It can damage the tissues. Okay, so the liver is getting damaged. Hepatic fibrosis can occur. Lenticular nucleus is getting damaged, so abnormal movements can occur. Especially the one point which I want you to know, it's a keyword. Those who ever have Wilson's disease, the lenticular nucleus is getting damaged, right? So in this patient, some abnormal movements you can expect, abnormal involuntary tremor-like movements you can expect. So if you ask them to keep their hands like this, immediately their hands will try to shake something like this. This is called as a bird wing. Okay, bird wing tremors. So okay, let me add here itself, bird wing tremors. Okay, that's okay because of the damage to the striatum, that's the chordate nucleus as well as the putamen. Chordate nucleus, sorry, not a chordate nucleus and the putamen, sorry, it's the damage to the globus pallidus as well as the putamen. Okay, globus pallidus and putamen together called as the lentiform nucleus. Okay, globus pallidus and the putamen together called as the lentiform nucleus. That lentiform nucleus is getting damaged. Okay, in Wilson's disease. So because of that, it's a structure of basal ganglia. Okay, the lentiform nucleus is a structure of basal ganglia, so abnormal movements can occur. Now the copper is also getting accumulated within the eye. So in this region, you can see that copper accumulation, which is going to give you a ring kind of appearance, a brown ring-like appearance. This is called as a KF ring. Okay, these are called as KF rings, Kaiser-Fleischer rings. Those can be seen in the eye. Now in pathology, general pathology, what you should know is the stains. What is the stain used for the copper? The stain which is used to look for the copper is rubianic acid. So rubianic acid is the stain for copper, and one more stain is there that is called as rhodanine stain. So rubianic acid and rhodanine are the stains for copper. Now what is the copper transporting protein? There is a protein, okay, in the blood. There is a protein in the blood. It's a plasma protein which usually transports the copper. The protein is called as ceruloplasmin. Now the point which I want you to know is, what's the stain for ceruloplasmin? Ceruloplasmin takes arsine stain. Okay, arsine stain for ceruloplasmin. Next, there is a condition where a substance called as a homogenesic acid. This homogenesic acid is accumulating within the cells. So what is that condition? Homogenesic acid accumulation. So this homogenesic acid is getting accumulated in a condition called as alkaptonuria. Okay, alkaptonuria, where this accumulation of this homogenesic acid is going to give this pigmentation, this dark color pigmentation in the cartilaginous areas. Okay, in the pinna you can see the cartilaginous areas are getting little darker in color because of the homogenesic acid accumulation. So that is condition is called as achronosis. Okay, achronosis, homogenesic acid accumulation. Next, the other pigment accumulation which I want to discuss here is called as the lipofuscin. Very much important for the exam. As the cells are getting older and older, okay, the cells are getting older and older, there is a wear and tear, damage within the cells, okay, within the tissues, there is wear and tear damage. For example, my heart is there. Imagine after 40 years or 50 years, okay, if that heart is still beating every day, so there will be some wear and tear damages will occur, right? So there is this pigment because of this wear and tear damage which is called as a lipochrome. Lipochrome or lipofuscin. So this lipochrome or lipofuscin, it's a wear and tear pigment. Wear and tear pigment. It's a brown color pigment. Brown golden color pigment, okay, brown pigment. It is seen in the brown atrophy of the heart. Brown atrophy. Okay, brown atrophy of heart. Okay, it's seen in the brown atrophy of the heart. You can very clearly see it's in the perinuclear region. Okay, in the perinuclear areas, you can see this golden color or brown color deposits. This is nothing but the wear and tear pigment which is called as a lipochrome or lipofuscin, which is seen in the older tissues, okay, which is seen in the older cells. So where it is present, it's a perinuclear, okay, perinuclear brown pigment. Okay, it's a perinuclear brown pigment. So what is the stain for such lipochrome? What is the stain used to look for this lipochrome? It is called as oil red O. Stain is oil red O. Oil red O you can use, or you can also use Zn stain. Same Zn stain, the Gill Nielsen stain which you will study in your microbiology also. So Zn stain can be used. Okay, so why sir, why such pigment accumulation? What exactly is this pigment? From where exactly it's coming? See, in older cells, as they are getting older and older, which means like more free radical damage is going to be there. So let me write free radical damage. Of what? Free radical damage is going to cause lipid peroxidation, whatever the lipid is there in the cells. So that lipids are getting the peroxidation of the lipids is going to produce this pigment. Okay, so free radical damage causes lipid peroxidation. Okay, lipid peroxidation is the one which is responsible for this lipofuscin. That's a perinuclear brown color pigment which is stained with oil red O and Gill Nielsen stain. Here also you can very clearly see by electron microscopy the pigment appears as perinuclear and electron dense. See, this is a nucleus, perinuclear electron dense pigment. See all this is the brown pigment or lipochrome. Now following this, let's discuss about the lipid accumulation within the cells, lipids. Okay, lipid accumulation. In which condition you can see the lipids within the cells, lipid accumulation within the cells or tissues? First is fatty liver. Fatty liver, that's the most common. You know it, right? Those who are alcoholics, obese people, fat is going to get accumulated within the hepatocytes. There is ballooning of the hepatocytes because of the accumulation of the fat. Okay, that's a fatty liver. Next, first condition. Second condition is cholesterolosis. Okay, cholesterolosis or strawberry gallbladder. Strawberry GB, that's the strawberry gallbladder. You can see the cholesterol accumulation. See, it's the whole cholesterol. It's just looking like a strawberry, right? But it's all the cholesterol getting accumulated in the wall of in the cells of the gallbladder. Okay, so this is cholesterolosis. Now, such lipids are going to be stained by. Lipids are stained by oil red O. Okay, oil red O. Oil red O is the stain. Other stains like Sudan black B. Sudan black B, Sudan 4, Sudan 4 or osmium tetroxide, okay, osmium tetroxide, all these are the stains which are used for the lipids. Okay, these are the stains which are used to look for the lipids. Here you can very clearly see, sir, this is the all these red color dots, whatever you are seeing here, they are all the oil red O stains for the lipids. So you can very clearly see here all these black color pigments. What exactly are these black color pigments? These are black color pigments, nothing but the accumulation of lipid within the cells. Okay, the accumulation of the lipid within the cells. So the two stains which you should never ever forget is oil red O and Sudan black B. Okay, so oil red O and Sudan black B. Okay, these are the stains used for lipids. Okay, in histology, whatever you are seeing this, okay, this white spaces, this lacunae, they are nothing but the lipid accumulations. Okay, the lipid is cleared away so that you are having only the empty spaces. So whenever you see such kind of vacuolated appearance, you should understand, okay, that is the area where lipid used to be there. That's the area where lipid used to be there. Okay, it was washed away, it was cleared away so that you are having the empty spaces. Okay, next, let's talk about the glycogen accumulation. See, glycogen is going to be accumulated in certain cells, in certain diseases. They are called as glycogen storage diseases. Glycogen storage diseases. See, you can see the lipid accumulation. Okay, good. In diabetes mellitus, see, in diabetes mellitus, there is lots and lots of glucose that's getting excreted, right, in the urine. So this glucose will be taken up by the PCT epithelial cells, and this glucose there will be stored as a glycogen. Okay, so in diabetes mellitus also there is accumulation of this glucose in the proximal convoluted tubule. The glycogen will be accumulated. Okay, so these cells where the glucose is getting accumulated or the glycogen is getting accumulated, is getting stored. These cells are called as Armani-Epstein cells, which are seen in the kidneys in diabetes mellitus. So they are called as what? Which cells? Armani. So what exactly I am talking about? I am talking about the Armani-Epstein cells. So what exactly are these Armani-Epstein cells? I have explained you. These are the cells in which the glycogen is getting accumulated. Okay, which is usually seen with diabetes mellitus. So I am discussing about the Armani-Epstein cells. The Armani-Epstein cells are nothing but the cells in which the glycogen is getting accumulated. So that's it. Now what are the stains? What are the stains used for glycogen? The stains used for the glycogen are PAS stain. Okay, periodic acid Schiff. Okay, so PAS stain can be used. The point which I want you to know is, see, it's a dash-stage sensitive. Okay, so glycogen, those cells which are having the glycogen and which are getting stained with the glycogen, is a PAS stain, but the glycogen is dash-stage sensitive. Okay, it's a dash-stage sensitive. This is the point which I want you to know. Okay, dash-stage sensitive. After this, the next point I want to discuss, or the next topic I want to discuss, is calcification. Calcification. See, what exactly is calcification? Accumulation of calcium within the tissue. The calcium is coming and getting deposited within the cells or within the tissues. The calcium is getting accumulated. Okay, how many types of calcification are there, sir? There are actually two types of calcifications. You should know for your exam, that is dystrophic calcification. Dystrophic calcification and metastatic calcification. So dystrophic calcification and metastatic calcification. So what exactly is dystrophic calcification? See, in dystrophic calcification, the calcium levels in the body are normal. In our body, the calcium level, whatever the calcium is there, is absolutely normal. There is no increase in the amount of calcium. But wherever there is some damaged tissue, dead tissue, some problem is there in that tissue, some tissue damage is there. So in that area, wherever there is damage, the calcium is going and getting deposited in that area. So in that damaged tissues, in that tissues wherever there is a dystrophy or some problem, the calcium is going there and getting accumulated. So this is called as a dystrophic calcification. So remember, D for D. Dystrophic calcification is seen in tissues wherever there is a damage. So calcium, let me write, accumulation in damaged tissues. Okay, after the cell death, the calcium is going there and getting deposited. But what exactly is metastatic calcification? Metastatic calcification means the serum calcium levels the serum calcium levels are elevated because of whatever might be the reason, because of some underlying pathology, the blood levels of calcium is more, so much calcium is there, and that calcium is getting accumulated in the tissues. Because of so much calcium in the body, the calcium will go and deposit in the kidneys. Okay, now leading to the kidney stones or within the nephrons, leading to nephrocalcinosis. Okay, so that is called as a metastatic calcification. Okay, so what are the examples of dystrophic calcification? Examples include Samoma bodies. And in TB condition, in TB, you can see the calcium will go on getting deposited in the lymph nodes. The calcium will go on deposit within the lung. Next, in atheromas, in atheromatous plaque within the blood vessel, there is an atheromatous plaque. Now, in that area, in that atheromatous plaque, there is some damage. In that atheromatous plaque, the calcium is getting going and getting deposited. Okay, these are the points which I want you to know. So, what exactly are the Samoma bodies? Students will have a doubt. Samoma bodies are, see, it's actually the cancers. For example, look here, it's actually a cancer. Okay, now in that cancer, the calcium is going and getting deposited. Okay, so usually Samoma bodies are seen in certain cancers. So, for example, this is a tumor cell, for example, tumor cell. Now, around the tumor cells, the calcium is going there and getting deposited in the form of concentric layers. In the tumors, the calcium is getting deposited in the form of concentric layers or lamellated appearance. These are called as Samoma bodies, and Samoma bodies are examples of dystrophic calcification. Samoma bodies are seen in, like for example, this is also a question. Samoma bodies are seen in, there is a mnemonic which is called as most PG. This is the mnemonic, sir. Most PG is the mnemonic. M for meningioma. Meningiomas, mesotheliomas, mesothelioma. Asbestosis can lead to mesothelioma, the cancer of the pleura. Okay, meningiomas, cancer to the meninges, tumor to the meninges. Oh, serous cystadenoma of the ovary. Serous cystadenoma of ovary. Papillary carcinoma of papillary, cancer of salivary gland. Okay, papillary cancer of thyroid gland. P for prolactinomas. Okay, and G for glucagonomas. Okay, G for glucagonomas. So, in all these conditions, okay, this most PG, the mnemonic is most PG. In all these conditions, what you have is the Samoma bodies, and the Samoma bodies are examples of dystrophic calcification. It's nothing but the calcium, the lamellated calcium appearance. The calcium is getting accumulated over there in the form of concentric layers in the tumor cells. Now, okay, done. So, after this, let's discuss about the metastatic calcification. See, metastatic calcification is seen in those conditions where the blood calcium levels are raised. Okay, the blood calcium levels should be raised. In which conditions the blood calcium levels will be elevated? So, condition number 1 is hyperparathyroidism. Hyperparathyroidism means more amount of parathyroid hormone is there. More amount of parathyroid hormone is there. So, what is the function of the parathyroid hormone? Parathyroid hormone is going to increase the blood calcium levels. So, that more blood calcium is there, the calcium will go and get deposited in the different tissues. So, it's a metastatic calcification. So, hyperparathyroidism, primary hyperparathyroidism especially, is going to cause metastatic calcification. You know, it bones, moans, groans because of more calcium. Okay, more bone related problems will occur, bones, moans, groans. Okay, because of high levels of parathyroid hormone. Okay, high levels of parathyroid hormone is going to cause a breakdown of the bones. Okay, more calcium is coming into the blood circulation. So, bone related problems like joint pains can be there. Okay, something like that. So, second condition is renal cell cancer. Renal cell carcinoma. Next, sarcoidosis. In sarcoidosis, the ACE enzyme, ACE enzyme levels are going to be elevated and the calcium levels are going to be elevated. Exactly, we don't know what is the reason. And one more cancerous condition called as a multiple myeloma. So, in multiple myeloma also, the calcium levels are going to be elevated. So, in all these conditions, one more condition called as a milk alkali syndrome. So right now I just don't want you to go into what exactly is renal cell carcinoma doing, sarcoidosis, multiple myeloma, milk alkali syndrome. We can discuss these things in later on. But right now the only point which I want you to know is in which conditions you can expect the metastatic calcification. I have given you the 5 examples. At least remember these 5. Okay, in all these conditions the blood calcium levels are elevated, metastatic calcifications. Now some other MCQs which I want you to know is calcium first deposits in. Okay, calcium is getting deposited. Okay, where it will first deposit? It first deposits inside the cell. Where? In the mitochondria. Calcium first deposits in mitochondria. In cell injury also we have discussed. In irreversible cell injury the calcium is entering into the cell, the calcium will go and deposit in the mitochondria. That is called as a large flocculent mitochondrial densities which are the pathognomic or hallmark of irreversible cell injury. We have discussed that. So calcium first accumulates within the mitochondria. The only exception is the basement membrane of kidneys. Okay, in the basement membrane of the kidneys calcium is going to be accumulated. The basement membrane of the kidneys first calcium will be accumulated. That's the one exception. Otherwise, it's the mitochondria. Okay. So, what are the stains for the calcium? The stains which are used for the calcium, to look for the calcium, whether the calcium is getting accumulated in the cell or not. The stains are called as von Cosa. Okay, von Cosa, stain number 1, alzarin red, or you can say it alizarin exactly, alizarin red. Third one, calcium. Okay, so at least von Cosa is important for your exam and alizarin red is important for your exam. So von Cosa and alizarin red are the stains which are used for calcium. So these are, see, these are calcium deposits. These are all the calcium deposits. Okay, this is alizarin red. Here you can see the calcium. This is all this red color pigmentation is nothing but the calcium. Here the black color pigmentation is von Cosa. Okay, von Cosa stain which is showing the calcium in black color. So with this we have completed the topic of intracellular accumulation. So different substance accumulation within the cell. Also in this video we have completed the calcifications. Very important is differences between dystrophic calcification as well as metastatic calcification. In which condition dystrophic, which condition metastatic. Examples are very much important. Some of our bodies example of dystrophic. Okay, hyperparathyroidism, metastatic calcification. Okay, hope the video is helpful. Thank you.